Understanding the clinical diagnosis of multiple sclerosis and the role of ancillary tests. Multiple sclerosis, MS, is a complex neurological disorder that affects the central nervous system, causing a range of symptoms and challenges for those diagnosed. The clinical diagnosis of MS is a multifaceted process that involves careful consideration of medical history, neurological examinations, and the integration of various ancillary tests. This essay explores the steps involved in the clinical diagnosis of MS and examines the crucial role played by ancillary tests in supporting and confirming the diagnosis. Clinical presentation. The first step in diagnosing MS is a comprehensive clinical evaluation. A healthcare professional, typically a neurologist, assesses the patient's medical history and conducts a thorough neurological examination. MS is characterized by a variety of symptoms, including but not limited to vision problems, muscle weakness, coordination difficulties, and sensory disturbances. The presence of symptoms that occur in different areas of the central nervous system over time is a key characteristic of MS. McDonald criteria. The McDonald criteria, a set of guidelines established by the International Panel on the Diagnosis of MS, provides a standardized framework for diagnosing the disease. According to these criteria, the diagnosis of MS requires evidence of dissemination of lesions in both time and space, reflecting the multifocal nature of the disease. Clinical and paraclinical, ancillary test, evidence is essential for meeting these criteria. Ancillary tests supporting diagnosis. 1. Magnetic resonance imaging, MRI. MRI is a cornerstone in the diagnosis and monitoring of MS. It allows for detailed imaging of the brain and spinal cord, revealing the presence of demyelinating lesions, inflammation, and atrophy. Lesions observed on MRI should be disseminated in space and time to fulfill the McDonald criteria. 2. Cerebrospinal fluid analysis. Lumbar puncture, or spinal tap, is performed to analyze cerebrospinal fluid, CSF. Increased levels of immunoglobulin G, IgG, and the presence of oligoclonal bands may suggest an abnormal immune response seen in MS. CSF analysis can contribute valuable information supporting the diagnosis. 3. Evoked potentials. Evoked potentials measure the electrical activity in the brain in response to stimuli such as visual, auditory, or sensory input. Delayed responses may indicate demyelination and help confirm MS diagnosis. 4. Blood tests. While there is no specific blood test for MS, blood tests may be conducted to rule out other conditions that mimic MS symptoms, ensuring a more accurate diagnosis. Challenges and limitations. Despite the advancements in diagnostic tools, diagnosing MS can be challenging due to the variability in symptoms and the absence of a single definitive test. Some patients may experience atypical or mild symptoms, making the diagnostic process more complex. In conclusion, the clinical diagnosis of MS involves a careful examination of symptoms, medical history, and the integration of ancillary tests. Advanced imaging techniques, cerebrospinal fluid analysis, evoked potentials, and blood tests all contribute to the comprehensive assessment required to diagnose MS. The ongoing refinement of diagnostic criteria and the development of new technologies hold promise for improving the accuracy and efficiency of MS diagnosis in the future. Early and accurate diagnosis is crucial for initiating appropriate treatment strategies and improving the quality of life for individuals living with MS.